Welcome, friends, to yet another webinar from Digital Dojo. The topic for today is IoT driven connected healthcare. I've already done some webinars on IoT, the introduction, trends, predictions, use cases. Today, I have chosen an industry where IoT is bringing a big change. So, the next 30-40 minutes, we'll be looking at this industry and the kind of changes that IoT is bringing to this industry. The agenda for this session will be we'll be looking at the opportunities in healthcare, why IoT is going to play a role, what are smart biosensors, and then we'll be looking at this concept of connected healthcare. So we'll be doing a preliminary look at the healthcare industry with respect to IoT. To begin with, the opportunities in healthcare. If you look at the traditional healthcare, if we fall ill, we need some medical treatment. We go to the doctor prescribes some tests for us. We do those tests, we go back to the doctor interacts with the patient. There is an iteration of this process, and at the end of this process, the patient is supposed to get well. The funny side, of this iterative process is when the patient visits the doctor, the doctor generally tries to treat the patient. There are some tests, a specialist gets called, pharmacy is involved, and more often than not, as a patient, if we are not doctors, but if we are on the other side of the table and we are patients, we generally feel disillusionized about this entire process of healthcare. Many of us even stop going to doctors, because we don't really trust not the doctor per se, but the entire system of healthcare, which is bad for us because if we don't go to the doctor, if we don't get treated, it is going to affect our health. It is bad for the entire system because if people don't use this system is going to rust, and eventually the system will not be effective for the purpose it was created. Some of the challenges in healthcare today are there is an aging population across the world, which is becoming a burden on the healthcare system. When we speak of the healthcare system, we are talking about the pharmacies, we are talking about the hospitals, we are talking about the doctors, we are talking about the nurses, we are talking about the laboratories, we are talking about the technology that supports all of these things. So more and more population that is becoming 60 plus. Countries like Japan, 70% of the population is supposed to be above 60 or above 50. Now that's going to be a huge burden on the healthcare system of such countries. So is the case with a lot of European countries. Apart from being aged, people who are crossed their 50s and 60s, they want to be independent. They want to have a respectful life. They don't want to be treated as patients. So the healthcare system has to be such designed that you give these very people what they expect, that is self-esteem and uh, an ability to live life on their terms even if they are patients. Primary care, that is the doctors, and the other healthcare workforce, nurses and pharmacies and so on. There is a shortage of such skills. There is clearly a mismatch between the resources available to deliver care and the demand for healthcare. As a result of which, if you apply the economic principle of economics of demand and supply, the equilibrium price or the overall price of healthcare is going to go up. There are new diseases, there are changing patterns of diseases that make it difficult to analyze and treat the diseases in the first go. In a lot of countries, medical specialists are available only in the cities. Whereas in the villages or on the rural side, it is a very dismal state of healthcare. In today's connected world, or rather a digital world, patients are well informed, about what they should expect, and they are demanding, especially the millennials, they are demanding that they get the highest quality of healthcare where they live and where they work. So healthcare is going through a lot of changes in today's time, and clearly the manual labor or the manual workforce, including the specialists, needed to address these challenges. There is a shortfall or there is a shortage. Worldwide today, we have more than a billion adults who are overweight, obese, almost a billion chronic diseases. So when I say chronic disease, we are talking about diabetes, cancer, cardiological diseases that take time to get cured or don't get cured in the entire lifetime. And there's so many people aged 60 or more. In an average, in a family, about 70 to 80% of their medical spend is on chronic disease management. Somebody is suffering from cancer, somebody is suffering from diabetes, somebody is suffering from blood pressure. If this chronic disease is managed well, there will be a lot of money that these families can then spend on some of the other things in life. They can live a much fulfilled life, a life of better quality. And lastly, the number of hospitals and the number of hospital beds that are available to treat the patients globally, there is a huge mismatch between demand and supply. What does that mean for the industry? So for the healthcare industry, it means that there is a massive market for new systems to improve productivity, to cut costs, and to support the shift of healthcare from the hospital to the home. Why? Because once you shift the focus of healthcare from hospital to the home, everything is going to fall in place. But how are we going to bring that shift from the hospital to the home? IoT is going to play a key role there. It gives us the concept of remote patient monitoring. So in some countries, it has already started, where sensor technology and communication channels are used to monitor data, get the data to clinical professionals, get it analyzed, and from a centralized location or from a location where the specialists are available, give treatment to people in remote locations. When I say remote locations, it is not necessarily rural areas. Of course, it means that we will be able to address the rural challenges better, but it also means that within a city itself, if your doctor is staying maybe 15, 20, 50 kilometers from where you stay, you will still be able to get treated from the same doctor without being able or without having to visit him for a personal checkup. So remote patient monitoring based on sensor technology, based on IoT, is gaining popularity in today's time. So the principles of IoT in a connected healthcare environment, there are four foundational or fundamental principles that IoT offers in the world of connected healthcare. One, in a connected healthcare environment, there will be an improved access to care. What does that mean? Even if I'm 50 kilometers, 20 kilometers away from my doctor, the sensor technology will tell my doctor instantaneously of what is happening within my body. The doctor will be able to respond to me much faster because of the sensor technology. If I'm a patient, I will get an increased quality of care. Why? Because the doctor is not only looking at my current set of data, but he will be using an analytical system which he himself will be analyzing, as well as there will be automated reports which will tell the doctor of what is happening within my body. So the doctor will have a first hand understanding of what is happening within my body. So he will know that what is happening within my body, what is causing me pain, what is causing me discomfort, all this information, analytical information. He starts off with the common treatment for the same symptoms. But in the world of IoT, because the doctor will have a lot of analytical data with him, he will be treating each patient in a very personalized manner. So every patient will get personalized care at the first instance when he approaches the doctor. He will not have to go to him 2 or 3 times to get diagnosed with the right uh, uh, disease. And finally, IoT connected healthcare is meant to reduce the cost of care. This is what happens with every technology. Initially, the technology is expensive, but as the technology keeps getting adopted, as it gets proliferated, the cost of care goes down. So when we are looking at the cost of care, there are two aspects to the cost. One is the monetary cost, and second is the psychological cost. Because you could get treated right at the first instance that you visit the doctor, you are much better mentally prepared with your body than otherwise. So if you are mentally in the right frame of mind, you have a better quality of life. It helps you save multiple trips to the doctor, to the hospital. Eventually, it also reduces your monetary cost of healthcare. Thus, IoT connected healthcare means right care for the right person at the right time at the right cost. After this, we will talk about biosensors and smart biosensors. What are biosensors? A biosensor is an analytical device used for the detection of an analyte. It combines a biological component with a physiochemical detector. Now, this definition is best understood with an example. Any one of you who is diabetic or who has somebody in the family who is diabetic will know that diabetic patients generally prick their fingers and then they collect this blood on a small strip which is inserted into a glucose reading device, and the sugar content in the blood is calculated. Now this device is a biosensor. So if you look at it, it is an analytical device. So this glucose biosensor, for example, AccuCheck by Roche, is an analytical device used for the detection of an analyte. So that analyte is the glucose component. It combines a biological component, that is a blood sample. It breaks down the blood sample with the physiochemical detector on the strip on which the blood is collected. So on the strip, the blood is collected, it is broken down, and the analyte or the glucose is then read by this biosensor, which is AccuCheck, to give us the glucose reading. Now, this is the definition of a biosensor. Now, let us understand what is a smart biosensor. Clearly, the AccuCheck that is given by Roche is not a smart device because every time you have to prick your finger, collect blood, and take the glucose reading. What happens if biosensors become smart? With smart biosensors, you will have biosensors which can do self-calibration. So in case there is any deviation in the blood sample, in the temperature, in the physiochemical component, the biosensor will be able to self-calibrate and adjust its readings accordingly. Two, the smart biosensors will collect this data and send it to a cloud system where this data can be accessed from any part of the world. Today, the glucose reader saves all the data within the device. It is not accessible to anybody else apart from those who read this device. A smart biosensor will be sending all of this data instantaneously to a cloud store. Computation will go from basic to advanced. So today the sensors give us the sugar reading, but smart biosensors are able to collect all the analytical data from the cloud and give us much more computed measurements than the basic sugar levels. Cost effective, because as technology evolves, smart biosensors will become cheaper, and smart biosensors will be used for multiple measurements. So today we have the AccuCheck or the glucose reader just to measure sugar. If it was a smart device, it would be able to read a lot more parameters from our blood apart from the sugar content. So smart biosensors are becoming more and more important to the world of connected healthcare. There are different types of smart biosensors. Intrusive biosensors, biosensors that are implanted into the body. So pacemakers, they sense a lot of things that's happening within the body, and they communicate all the data over a wireless system back to a cloud system. So we have intrusive elements completely inside the body. We have intrusive wearables. Now these are external devices. I will show you an example. Smart glucose meter. So we saw the standard glucose meter or the AccuCheck. We have smart glucose meters where a portion of that device is outside the body and there is an injection that is inside the body. So the portion that is outside the body takes decisions based on the data that is collected, and the injection is used to inject insulin into the body. But this dose of insulin is not the standard dose that doctors generally advise, but it will change every time the injection is given based on the data that is collected for that body. So intrusive wearables help give very personalized care based on data collected. Then we have consumer products, basically your fit bands, wristbands, smart watches. These are all health monitoring devices that come with a mobile app, even shoes for that matter. And we get a lot of information about our body on these apps. And in the medical infrastructures like hospitals and labs, we have smart medical equipment. So these are the traditional equipments like the X-ray machines, ECG systems that are made smarter. The moment they sense the data, they collect it and give it to the cloud for further storage and analysis. So we have different kinds of smart biosensors that are coming up in the world today. Now this is an example of the smart glucose meter. If you see, A is an insulin pump that stays attached to the body. It has insulin in it. B is the injector, is the delivery cannula for the insulin. C is the sensor. So just like you had this strip which breaks down blood, you have C which is inserted into the body, and D is the transmitter to the insulin pump. The way this works is that the sensor will first sense what is the glucose reading in that body at a particular instant. It will be programmed for that. The wireless transmitter will transmit that data to the insulin pump. Now the insulin pump is connected to the cloud. It gets all this information. It quickly runs an analysis and determines what is the level of insulin that should be injected into the body at that particular time. That those instructions are given to the delivery cannula, and that injected right into the body of the patient. This is how the smart glucose meter runs. There is no need to prick your finger 2-4 times in a day. There is no need to get worried about your blood sugar content, because depending upon the fluctuation of your sugar content, the insulin pump will determine the quantity of insulin that should be injected into your body. So if you look at these two graphs, for example, if you are using the manual glucose reader and you do two readings, and both the readings are within the threshold of your diabetic readings, you will think that your sugar levels are fine. But if you are injected with, you are having an intrusive variable like the smart glucose meter, it will be done periodically by itself, and there will be a better analysis done to determine your diabetic level. So if you use smart biosensors, you are saving time, you're saving energy, you have access to patient health data every day, every moment, every instant. You have very powerful analytics that can find out if things are going right, if things are okay, and you have indeed a real-time monitoring system. In case the sugar levels are on the higher side throughout the day, within the first couple of hours, you will get to know. You will be able to treat the patient before something goes wrong with the patient. The last theme for today is connected healthcare. I'm going to talk about connected healthcare more as a theme within the healthcare industry than specific use cases. We are just going to talk about this entire concept of connected healthcare. So, what is connected healthcare? Connected healthcare is an environment where smart biosensors are attached with the patient. As we have seen, the biosensors can be of four types. So the biosensors collect patient data in real time. When this data is monitored, the doctors have access to this data. They can recommend a proactive therapy to deal with change medical situation. So it is not necessary to take the patient to the doctor or do a test if something is going wrong. As soon as things go wrong, doctors will get to know of it and they will recommend a very proactive medical treatment. The doctor prescription, the change prescription can be sent over a mobile device to the patient, to the hospital, to the pharmacy, so that the patient is treated proactively before something goes wrong, before the patient actually visits the hospital. So you have this entire technology driven, IoT driven, connected healthcare system. Smart biosensors are key to the world of a connected healthcare system. What are the key benefits of connected healthcare? One, you will have reduced hospitalizations because people will be proactively treated. They will not be treated when things go drastically wrong. Before things can get drastically wrong, they will be treated most probably when they are at home. So the shortage that we spoke about the hospitals, about the medical beds that are available in the hospitals can be addressed with this system. Improved medical outcomes because people will be treated proactively. Anything proactive is better than a reactive system. Improved access to care. There will be no experiments with people. Everything will be based on analytical data. Affordable and convenient in the long term. There will be less travel to be made, less experiments, less tests to be done. So if aged people or people who are going through this trauma, they will feel much better. They will lead a slightly better quality of life. And overall in this world, it will lead to an efficient use of resources. We spoke about the mismatch of demand and supply, but in this world of connected healthcare, we will see that the resources are being efficiently used for effective reasons. So to conclude, It is the opportunities in healthcare, the very fact that there are unsolved problems with the healthcare industry is driving the need for connected healthcare. So connected healthcare is gaining popularity as a concept because of dire needs or major challenges of this healthcare industry. It is this technology that is enabling connected healthcare. So we are talking about IoT with smart biosensors, but you also need the mobile, the analytics, the cloud, the social media to ensure that IoT plus SMAC is helping solve the problems of connected or helping solve the problems of the healthcare industry. Connected healthcare provides interoperability, reliability, flexibility, and extensibility because there's a lot of devices which will be there with the patients, tested firms, tested by reputed firms, analytical data which builds on every historical data that is collected will give us a better, reliable, and flexible healthcare system. There's a lot of investment that is coming into connected healthcare because people are seeing the benefits. People are seeing not just from a social perspective, but even from an economic or business perspective, that if you're putting $10, there is scope to get $100 back. So investment in connected healthcare is definitely increasing. As technology standards evolve, improve, the cost of connected healthcare will go down. There is innovation happening in sensor technologies, biosensors, cloud, wireless communication, which is helping build a better device or rather medical device portfolio. So more and more efficient. When I say efficient, cost efficient, energy efficient, data efficient, biosensors and biosensor portfolios are being created. I hope you like this webinar. If you feel you want to receive more information like this, register on my website for newsletters, information, tips and tricks, www.digitaldojo.in. I have a Facebook page, digitaldojo.in. Please like and express your support. I also have a YouTube channel. You can search for Digital Dojo India. Subscribe to the channel. This video will be available on that channel if you want to listen to it again. I have a LinkedIn page. Follow me there. You can also connect with me personally on my Facebook, LinkedIn, or on my personal website. You are more than welcome. So this was about the webinar, Connected Healthcare, IoT-driven connected healthcare. Hope you like the webinar. See you next time. Thank you.